Agriculture for Health. My name is Peggy Yee, and I'm the Managing Director for the Center on Global Food and Agriculture at the Chicago Council on Global Affairs. The Chicago Council is excited to partner with Texas A&M AgriLife Institute for Advancing Health Through Agriculture to bring you today's conference. We are here today to discuss what we are calling the Ultimate Grand Challenge. The Ultimate Grand Challenge is to improve human health and reduce chronic diseases by leveraging the potential of responsive agriculture. You're going to be hearing this a lot today, that agriculture is the solution. Big problems are often framed as grand challenges, but few problems are as integrated in daily life as the ones we are going to be talking about today. Here, we will gather insights from the perspectives of all stakeholders across the agriculture and food value chain to chart a path forward. We are honored to have you, our esteemed colleagues, both in the room and joining us via live stream here with us today. Together, we can solve that ultimate grand challenge. Let me provide some background. The Institute for Advancing Health Through Agriculture formally opened in January in College Station, Texas, as the world's first academic institute bringing together research in responsive agriculture, precision nutrition, and healthy living. The Institute is collaborating with the USDA's Agricultural Research Service's Responsive Agricultural Food Systems Research Unit, which will work with other ARS units and land-grant universities nationally to leverage big data, state-of-the-art sensors, and computational systems approaches. It's been a privilege to get to know the Institute's leadership team, consisting of Reagan Bailey, the Associate Director of Precision Nutrition, Rebecca Seguin-Fowler, Associate Director for Healthy Living, and Elizabeth Parker, the Interim Associate Director for Responsive Agriculture and Associate Director for International Programs and Strategic Initiatives. And of course, leading those efforts is Institute Director Patrick Stover. You'll hear more about Patrick's vision to leverage agriculture as a solution to the grand challenge later this morning. Now, here to introduce our keynote speaker for this morning, it is my honor to welcome Distinguished Fellow at the Chicago Council on Global Affairs, Catherine Bertini. Catherine is the 2003 World Food Prize laureate and former UN Executive Director of the World Food Program.
Good morning. I'm honored today to have the opportunity to introduce Dr. Patrick Stover. His commitment to revolutionizing the field of nutrition is really exciting, and we'll hear much more about that in various ways today. He's done some of this already by raising standards of evidence, by improving public trust, and now harnessing the power of agriculture is his new commitment. I'm really looking forward, as I know you are, to hearing him share what he has in mind regarding the ultimate grand challenge. Patrick Stover is the director of the Institute for Advancing Health Through Agriculture, as Peggy mentioned, called IHA, so it's a new acronym to learn for the day, at Texas A&M AgriLife Research. The IHA is the world's first research institute to bring together precision nutrition, responsive agriculture, and behavioral research to reduce diet-related chronic diseases in a way that considers environmental and economic effects. With support from the U.S. Department of Agriculture and from the state of Texas, the IHA has an annual budget of more than $30 million and includes an embedded USDA program. As an international leader, Patrick's research focuses on the biological mechanisms that underline the relationships between food and human pathologies, such as birth defects and cancer. He is an elected member of the National Academy of Sciences. He's a fellow of the American Association for the Advancement of Science. He's also former president of the American Society for Nutrition, and he served 2 terms on the National Academies of Sciences, Engineering, and Medicine's Food and Nutrition Board. He received the Presidential Early Career Award for scientists and engineers from President Clinton. This is the highest honor bestowed by the U.S. government on outstanding young scientists and engineers beginning their independent careers. So I first interacted with Patrick when he was director of nutrition at Cornell University, and then when he was at College Station as vice chancellor and dean. I've watched him operate in both of those places, but I also was part of a committee that he chaired with a large group of nutritionists trying to get everyone to agree on what was in this paper. And I know from watching his skill doing that he'll be able to get together all sorts of different people from different walks of life that care about agriculture and nutrition in order to achieve his goals in this process. He's having dealt successfully with the challenge of pulling together researchers and people with their own opinions and backgrounds. Now, when he has the opportunity to do so, to improve human health and decrease chronic disease, I think he will be a star. So here at the Chicago Council, where we are proud of our work in agriculture and health and in the environment, we're really thrilled to host Texas A&M here today and to host their leader in this field, Dr. Stover, and his team. Thank you, Dr. Stover, for asking us to join you here today, all of us to join you here today for this very important discussion, because success in this area with intellectual firepower, the budgetary support, and the need that's so great in this country will make a huge difference to millions of lives. Thank you for your leadership. Welcome to the stage.
Well, welcome to all of you. I am really delighted to be with you here today to address the future of agriculture and food. So my name is Patrick Stover, and I am director of the Texas A&M Institute for Advancing Health Through Agriculture, where we believe that agriculture is the solution to some of the most pressing problems facing society today. So this morning, my job is to address the why. Why are we here today? And the short answer is to develop a roadmap, to get consensus around the ultimate grand challenge, which is to improve human health and address diet-related chronic diseases by leveraging the potential of responsive agriculture, which we will define later. But before I begin, I'd just like to acknowledge all of you. Present in this room today are leaders all across the agriculture and food value chain, both here in the room and those of you online. We have representatives of leaders from farm inputs all the way to consumer health. And your participation in this will be absolutely essential moving forward. I'd also like to acknowledge that we have some great guests here from Washington, D.C., from the United States Department of Agriculture. We have Dr. Jacobs-Young. We have Dr. Joe Rich here. We have Dr. Pam Stark-Reed, Dr. Dwyer, and we have Dr. Larry Chandler from the USDA. Thank you all very much for being here. We also have to acknowledge that we have in agriculture great supporters on Capitol Hill for agriculture, and they are essential to all of us. They're essential to the functioning of our food system. And we have two very important professional staff here from Washington, from the office of, from the office of Congressman G.T. Thompson. We have Jennifer Tiller here, who is Deputy Staff Director and a great champion of agriculture throughout her career. And we also have here today Jeremy Whitty, who works with Senator John Bozeman. He is a professional staff with a very broad portfolio that includes research and extension. Thank you very much for your public service and for your support of agriculture. So now I'd like to begin. And to begin with, where are we right now? Why do we have the food and agriculture system we have today? And in fact, it really began in the post-Depression and post-World War II era, where hunger and food insecurity were common, and there was a general sense that this was totally unacceptable. So we created an agriculture system that was built around trying to tackle the problem of hunger and food insecurity. and we dealt with it through the lens of calories. That is, how can we produce and produce in abundance food and calories so that hunger would be rare? And in fact, this was a tremendous success. While we recognize today, and we have to recognize that there is hunger in this country, there is food insecurity in this country, it's not due to a lack of food production, it's due to other issues. There was a commitment by the government to create a food system that would make food affordable, accessible, abundant, and it succeeded in its goal. And that's the legacy that we live with today. But it's often been said that yesterday's solutions are today's problems. And in fact, now we have other problems, and that is we have a scourge that continues to rise of chronic disease incidents in this country, much of it related or driven by our food system. You see here diabetes and how it has grown since 2004 to 2014. And in fact, we are seeing rises in obesity. We're seeing rises in certain cancers related to diet. Diabetes, as we've seen, cardiometabolic and other chronic diseases which continue to rise. These diseases lower quality of life and mental health. They diminish individual capacity and opportunity. They diminish productivity of the workforce. They diminish our economy. Today, 60% of US adults have a chronic disease, and 40% have more than one. And food is a major contributor to these chronic diseases. And importantly, the burden of chronic disease is not shared evenly across the United States. The burden of chronic disease is concentrated, the greatest burden, in our underserved and in our minority communities. The total cost of food-related disease is estimated to cost the US economy over $1 trillion annually. If you just think about diabetes, the cost of treating type 2 diabetes is now estimated to be about $250 billion annually. That's bigger than the budget of many federal agencies. And if you add in the economic costs, you can add another $100 billion to that. That's diabetes alone. No one is immune from the effects of the crisis, but the disease is disproportionately distributed in the US. These same chronic diseases contribute to declines in life expectancy, with once again, our underserved communities showing the starkest decreases in life expectancy. How can you have numbers like this and have equal opportunity for everyone? And it really calls into the question, quite frankly, the stability of our civil society looking forward when we have these sorts of disparities. Now, while our food system remains strong, its vulnerabilities were exaggerated during the pandemic. On the consumer side, we saw that those with obesity, those with cardiometabolic disease, suffered the highest rates of morbidity and mortality. On the consumer side, on the production side, while overall the food system performed very well, there were some short-term hiccups in the supply chain, but those were resolved. But it was also viewed that we need more resiliency in the food supply, especially in times of crises. And that's something that a number of organizations have been focusing on. And right now, resiliency and vulnerabilities in food production are top of mind for all of our producers, as they are experiencing these extremes in temperatures, both rapid hot, rapid cold, which make it very difficult to produce, but they're also seeing volatility in commodity markets and input markets, all which threaten food production now and into the future. And when we think about threats, economic threats to agriculture production, we also have to keep in mind that we need a strong rural and agriculture economy that can compete with other industries. Today, we are losing precious land to other more profitable enterprises for land, including urban development and including solar energy. We have to make sure that we have a strong agriculture economy, or we're not going to have that food to create healthy people. But the economic impacts of the food system go far beyond mere food production and land use. The agriculture and food economy we have today was designed to address hunger and food insecurity. Food is now produced in abundance, creating low costs for the consumer, hence low profit margins for producers. However, as mentioned earlier, there are significant and growing costs emanating from the food system that are then externalized into the healthcare system, creating unsustainable healthcare costs. So that brings us to the ultimate grand challenge. How do we improve health and reduce chronic disease by leveraging the potential of responsive agriculture? And I'm sure you're all wondering, what does responsive agriculture mean? And we will get to that momentarily, but let me give you some more background around that. So yes, we need to produce more food. We need to become more efficient at food production because we know there's going to be another 2 billion people on this planet. And so increasing food production has to happen. But we have to do it in a way that creates healthy populations. That's the real challenge. And I love the irony you see here on this Journal of Nature, where they talk about, can science feed the world? Can we become more efficient? Can we scale to meet this growing population? But we also have diabetes on the cover. That's the irony of where we are right now. Now, we do have success stories that agriculture and food can be the solution. And in fact, one of them is the folic acid success story, which I've participated in throughout my career. In the 1990s, there were clinical trials that showed that certain women were disposed to having a child with a birth defect called spina bifida. Spina bifida is devastating for kids. It results in lifelong paralysis and disability. Yet those clinical trials showed that for those women who were predisposed to having a child with a birth defect, if they got more folic acid, if they got additional folic acid, more than you could get out of a normal food-based diet, they could prevent the risk of having that child. And in fact, the clinical trials showed that, led to fortification of the food supply with folic acid. And in fact, spina bifida has been virtually eliminated from this country and from other countries that have fortified the food supply with folic acid. I want to emphasize here, at that time, there was not a folate deficiency in the population that drove the fortification. It was to address 2,500 births a year that were afflicted with spina bifida. We manipulated the food supply to achieve a health outcome, and it was a great success. These and other types of initiatives led the National Academy of Science, Engineering, and Medicine, I'm sure with prodding from our federal authorities, to develop a framework report for setting dietary reference intakes based on chronic disease. So dietary reference intakes are the recommended daily allowances for all your vitamins and nutrients that then translate into the dietary guidance that then tell the American consumer what they should consume. Well, setting the point from hunger, and when I say hunger, I mean regular hunger, energy requirements, I mean hidden hunger, micronutrient deficiencies. That is setting guidance based on adequacy, what you need so you don't become deficient. Moving that to an outcome of health is monumental. Moving it, recommendations to prevent chronic disease is what the future is, and this report has now been partially implemented. We saw it in the last sodium report that came in. They started using chronic disease endpoints. So in fact, we are beginning to move the food system from avoiding deficiencies to this outcome of using food to support health, at least in the sector of dietary guidance. But what about other sectors, like the food environment, like the food supply, et cetera? Now, when we set the endpoint to chronic disease prevention, moving from avoiding deficiency to trying to address issues of chronic disease prevention, we ran into a lot of biology that's very complex. And that is, this brought on the advent of precision nutrition. When you address a nutrient deficiency, or you try to supply enough nutrients in food so that your physiology works properly, you are adequate in your intake of essential vitamins and nutrients, the entire population responds the same. Within 98%, you get about a 2% standard deviation there. So populations respond similarly to deficiency. But when you use the chronic disease endpoint, you need more precision because, as Francis Collins has said, one size doesn't fit all. We all react differently to food in that diet-disease connection. Hence, under the leadership of Dr. Jacobs-Young, who you will hear from later, and at NIH, there have been initiatives around precision nutrition. That is, how do we match people and food to support that health outcome? And the reason that we see these differences among people and that diet-disease relationship is because human populations emerged all over this planet. Those populations that succeeded, that is, they expanded and grew, were ones that could adapt to their local food environment. Those that did not survive. And of course, the food environment is very different around this planet. So if you look at people from Scandinavia, where there's very little iron in the soil, they adapted to having systems that were really good at getting all the iron out of food. Now when you give them food that has plenty of iron, they get hemochromatosis. If you look at populations in northern Canada, the Inuit populations, they metabolize fat very differently than the rest of the globe because that's what their dietary source was. So this is all rooted and very well established in our evolutionary biology history and becomes a challenge for us now to match diet and food for health. But this is an exciting area of research. And the concept of precision nutrition was beautifully demonstrated, proof of principle, by my colleague at Texas A&M, David Threadgill. He took 4 different strains of mice, genetic strains of mice, fed them 4 different diets, and let them age out, and measured every health parameter he could to ask, what's the perfect diet? And in fact, the result was there was no perfect diet. The diet depended on what mouse strain and what health outcome you were most interested in. So the concept of precision nutrition works across species. We understand that diet-disease connection is complex. So what do? How do we achieve an agriculture and food system that actually promotes health? The science of precision nutrition is still in its infancy, and we can't wait for that research to continue to develop. Are there things that we can do now? And the answer is absolutely yes. We have a lot of knowledge, we have a lot of tools to begin to look at the supply side, if you will, or the production side of the food chain to create healthier people with the knowledge we have right now. So that brings us to the definition of responsive agriculture. And I want you all to pay attention to this, of what's in frame and what's out of frame, because this will become important for our discussions today. But we define responsive agriculture as an agriculture system and food environment that supports health through nutrition while ensuring the system is economically and environmentally sustainable for future generations. So you see all sorts of initiatives in this space across the country, across the world, related to the environment, related to economics, related to human health, related to production. But what we need to do is prioritize. We need primarily a food system that produces human health. And we need to do that in the context of both environmental and economic sustainability, and we will talk about that. Now, there are things that are out of frame that are very important, but they're not in frame for today's discussion. First, we recognize that the food system is global and interconnected. There is no such thing as the domestic agriculture or food system. It is a global enterprise. But today we're going to focus on the US system. Number 2, we appreciate that agriculture is more than food. It's fiber, it's fuel, it's carbon capture. There's a whole agriculture bioeconomy. We are focused on agriculture as it relates to food production. And lastly, we're not talking about the consumer today. So we realize that individual choices and individual agency, that is the ability of an individual to have the knowledge, the skills, and the resources to make healthy choices, are absolutely important in that diet health connection. But today we're talking about everything from farm inputs up to the food environment that we experience, but we're not going to talk about the consumer today. And when we talk about food production, we have to consider the entire agriculture and food value chain. Everything from farm inputs all the way down to what the food environment is that every individual experiences every single day. That is what we talk about when we talk about responsive agriculture. And I'll give you an example. If you believe that our food supply needs more selenium, and I know a lot of selenium people who love selenium and think we need more, that's a farm input issue of some sort, because the amount of selenium in food relates to the amount of selenium in the soil, et cetera. By considering the entire agriculture and food value chain, we maximize our opportunities to achieve health as the outcome. So shown there is the ag value chain with food and food services going in one direction, demand and information going in the other. But in those bubbles, what you see are opportunities for interventions. These are our opportunities to achieve that health outcome. So we have social organizations like education. We have science and technology. We can improve the biophysical environment. We have markets and policies where we can intervene. These are all opportunities for us to achieve health, and we need to use every opportunity we can to achieve that health outcome. So we need to consider the entire agriculture and food value chain. I also want to emphasize technology. We have today the unprecedented ability, the tools that allow us to make the food system whatever we wanted it to be. But what do we want? What are our priorities? Let's define a food system and food environment that promotes health, that lowers healthcare costs. That's the driver for a lot of these initiatives. Nobody can afford the healthcare costs. Let's identify what the barriers are to achieving those, and let's chart a path forward. Again, I just want to emphasize, we can do whatever we want as a society. We have so many tools, so many technologies, so many opportunities. But we have to define what we want. We have to define what our priorities are. Let's define what the food system is that we want to achieve, a food environment that promotes health and lowers healthcare costs, and move forward. So what is the path to success? And there may not be one path, there could be many paths. But how do we establish a process to establish priority actions in the short term, the intermediate term, and the long term that get us to that place where we're not worried about healthcare costs due to food? This is probably the most critical point I'd like to make. And this, again, is a report that Catherine Bertini referred to. If we are going to really achieve responsive agriculture, that is, consider the entire ag value chain, we must emphasize the importance of trust and the importance of trust in all of its dimensions. A recent Pew survey found that the general public doesn't trust nutrition scientists or nutrition research. Customers are very wary of dietary guidance and food technologies that are essential to achieve our vision. We recognize there is tension across those who eat food and those who produce food. Many don't even know where their food comes from. We also have to recognize that the food system is rife with non-scientific preferences, values, and beliefs, yes, special interest, and partisan politics. We must get beyond these and let science drive the food and agriculture system that promotes health. We must acknowledge that everyone has vested interest in the food system as it is configured today, but we can work together for the benefits of both producers and consumers to achieve that health outcome. We need to work collectively to ensure that our policies, practices, and incentives across the entire food system are scientifically grounded, support health as the outcome, provide opportunity for producers. We must be science-oriented and solutions-focused, period. I'll repeat that. We have to be science-oriented and solution-focused. Again, I suggest that this is the ultimate grand challenge to advance society. We need a focused, inclusive national effort, as we did for the Apollo project to explore the moon, as we did for the Green Revolution to tackle hunger. Responsive agriculture must be our highest priority as it impacts everyone, every day, in every aspect of our society. We recognize now we are on an unsustainable course. We must bring the four complex dynamic systems of food, people, economics, and the environment into alignment with the goal of achieving human health through agriculture and food. So I know everyone in this room sees agriculture as the only viable solution to the growing human healthcare crisis we have, or you wouldn't be with us here today. We experience food every day as a nation. We experience the consequences of our food system every day as a nation. But we can succeed with responsive agriculture, and we can make it a national priority. So I'm asking you to please join us on this journey with our partners, the United States Department of Agriculture and the Chicago Council, as we make agriculture the solution. Thank you very much. Now, before I begin to introduce the panel, as we begin to walk into the program now, I do want to acknowledge my colleagues. So these are the brains behind the operation we have here. They are all in the room today. They were mentioned earlier. But we were really happy to have recruited this year Reagan Bailey, who is Associate Director for Precision Nutrition. She's a member of the National Academy of Medicine and world recognized as a leader in nutrition epidemiology and in developing methods to make that connection between diet and health. And she was a member of the 2020 Dietary Guidelines Committee. On the responsive agriculture side, I'm delighted to introduce Associate Director Elizabeth Parker, who is a veterinarian, has a long distinguished career in both science, animal infectious disease, as well as science policy. She was on Capitol Hill for many years, and for many years was in Rome at the United Nations Food and Agriculture Organization, and we're delighted to have her here at IHA. And our Healthy Living Hub, which is our translational hub, is led by Dr. Rebecca Segan-Fowler. I've had the pleasure of recruiting her twice in my life, once to Cornell and once to Texas A&M. There is nobody in the world who is better at community-engaged participatory research to look at the effectiveness of health intervention programs and do it in a way that is scientifically rigorous, achieves results, and are sustainable. She is a world leader in this area. And so as you can see, the Institute covers the entire spectrum of the ag value chain, everything from production to healthy living. And so I just want to recognize the people who make all of this happen. So the next part of our program is to hear from some of our panelists, and I'm going to introduce our first panelist, who was going to be here today, but there was a family emergency, and Jessica Fanzo very, very generously agreed to record comments for us, so we will hear those next. Jessica Fanzo is the Bloomberg Distinguished Professor of Global Food Policy and Ethics and Vice Dean for Faculty Affairs at the School of Advanced International Studies at Johns Hopkins University. She holds appointments in the Berman Institute of Bioethics at the Bloomberg School of Public Health. From 2017 to 2022, she served on the Food Systems Economic Commission, the Global Panel of Agriculture and Food Systems for the Nutrition Foresight Report, the UN High-Level Panel of Experts on Food Systems and Nutrition, and she served on the Eat Lancet Commission. With 20 years of research and program experience working in sub-Saharan Africa, South and East Asia, and the United States, her area of expertise focuses on the impact of transitioning food systems on healthy, environmentally sustainable, and equitable diets, and more broadly on the livelihoods of people living in resource-constrained places. So as you can see, we brought, as you'll see throughout the day, a number of high-level experts all throughout the food system to join us in this effort. And so I give you Jessica Fanzo, I think.
My name is Jess Fonzo, and I'm very sorry I can't be with you today. I'd like to talk about identifying research priorities to solve the ultimate grand challenge, which to my mind is food system transformation. So what is our charge as researchers? We're heading on a trajectory that is far from ideal. The global population is forecast to grow as much as 5 billion by the end of the century. Food systems will have to feed this ever-growing and shifting population using the same resources that are on hand, but with additional pressures coming from climate change, environmental degradation, and loss. Food systems are further challenged by a global pandemic and the Ukraine-Russia conflict that is like nothing we have witnessed before. While the challenges we face are daunting, the opportunities are also vast. Food systems must adapt and transform to deliver sustainable, healthier diets and durable livelihoods without decimating the planet. The research community should rise to this challenge and translate high-quality science into policy and action. So why is research important? At a time when facts, science, and evidence are under ever greater scrutiny and even openly disregarded as suspect by some political and business leaders, the rigors of research have never been more critical. Research has a vital role in charting a positive and sustainable direction for global food security, nutrition and health, and climate mitigation and adaptation. The needed research will require a creative and holistic approach across disciplines, bringing knowledge together into publications that inform action at different levels, be they subnational, national, regional, and global. It is also important not to become disheartened by the slow speed of change in policy and practice, even when the appropriate course of action is clear to us as researchers. Research can and does bring wholesale changes in attitudes, political thought, and action, but change takes time. We've seen this with the climate change agenda. It may have taken 40 years for scientists to convince policy makers, but we are now approaching consensus at the global level that we need to take action, and we need near-term action to combat climate change. Many countries are doing action, not enough, but that would be unthinkable in the not too distant past to change the behaviors of our policymakers. So research must continue to generate evidence that can help speed progress in time to sustain planetary integrity and human development. So how do we do research better? It's a time when researchers need to better communicate their research findings to the wider world. For too many researchers, the sole focus is on academic publishing, and I am guilty of that as well. We as researchers need to see their role in terms of knowledge generation and the translation of this knowledge into a form that is understandable and relevant to decision makers in government, business, and civil society. Those who design, shape, and enact policies and practices at national and subnational and international levels need to access the research in digestible and accessible ways. Failure to achieve this brings a very considerable risk of being ignored. We as researchers must learn to sit at policy dialogue tables, not set for ourselves, but for the users of our research, that is, the policymakers. By listening to challenges that policymakers face, the research community can better design studies that result in practical and relevant findings that policymakers look forward to receiving and using. So how do we make our research relevant? Well, food systems is often viewed as a source of problems needing innovative solutions. This view is a valid one, but food systems themselves can be a source of innovations. And that many of the fundamental food security and nutrition problems facing the world are behavioral and require systemic change, including the perspective of social scientists. So I'm going to bring up 6 things of how we can make our research more relevant. The first is we need to embrace a more inclusive perspective on solutions to food security and nutrition challenges. This requires a fundamental cultural shift on the part of researchers. There's a need for research to be problem-focused and systems-based. We should embrace qualitative, quantitative research, indigenous knowledge. We need to embrace all types of data and evidence. Research and their funding agencies should also embrace multiple perspectives, including those individuals who live and work within food systems, and integrate natural and social sciences, innovation, policy, institutions, and practice. We also need to consider contextualization. Generalizability is not always what is most desired in research, as many food system challenges require contextual solutions, and solving those will require context and digging deep and ground truthing in many different places. Perhaps the most welcome and vital trend in research related to food security and nutrition is the groundbreaking discipline of breaking down disciplinary silos and shifting towards multidisciplinary, multisectoral research. There is evidence that this multisectoral, multidisciplinary approach is influencing policy and development practice. For example, efforts to promote nutrition and agricultural development, environmental sustainability are arguably better aligned today than ever before. Nevertheless, we need to continue to strive to work together across disciplines. I wanted to talk about two projects that we have that I consider quite multidisciplinary at Johns Hopkins University. The first is the Food Systems Countdown Initiative. Deliberately changing complex systems that cut across sectors, jurisdictions, and national borders calls for a comprehensive ongoing program of scientific measurement and assessment of all aspects of the system and their interactions to help guide decision makers and hold those in power to account for transformation. Food system actors and stakeholders need actionable evidence to make decisions that can bring about food system transformation. Yet no mechanism currently exists. The Countdown Project is developing such a mechanism by producing annual publications to measure, assess, and track the performance of global food systems towards 2030 and the conclusion of the Sustainable Development Goals. This project brings about 65 different scientists together working across different disciplines to try to create a tracking mechanism for global food system transformation. The second project we have is the Food Systems Dashboard, which combines data from multiple sources to give users a complete view of food systems. Users can compare components of food systems across countries and regions. They can also identify and prioritize ways to sustainably improve diets and nutrition and environmental sustainability in their food systems. So positively transforming food systems to ensure that the food we produce is accessible, sustainable, safe, healthy, and equitable for all is our moral imperative as researchers. At the same time, food systems should continue to be a vehicle to reduce poverty, directly improving food security among actors. Current food system transformation is creating significant sustainability and equity gaps that will make future food security and continuity of life on the planet difficult. As global citizens and as researchers, we have to fill in these gaps. We all have a role to play in ensuring we meet the demands of a growing population sustainably while coexisting in amity with the planet. Thank you so much.
Thank you very much, Jessica. I know that she is listening online, so we really thank you for giving us your thoughts. Next, it's my pleasure to introduce another member of the panel, Dr. Prabhu Pingali. He is professor in the Charles H. Dyson School of Applied Economics and Management at Cornell University, with joint appointments in the Division of Nutritional Sciences in the Department of Global Development, and is the founding director of the Tata Cornell Institute for Agriculture and Nutrition. Prior to joining Cornell, he was deputy director of the Agriculture Development Division of the Bill and Melinda Gates Foundation, and that was from 2008 to 2013. He was director of the United Nations Food and Agriculture Organization's Agriculture and Development Economics Division from 2002 to 2007. In addition, he has worked with CGIAR for 15 years, from 1987 to 2002, first in the Philippines and then in Mexico. Dr. Pengali is a world-renowned expert, a fellow of the American Association for the Advancement of Science, a member of the National Academy of Sciences, and an AAEA fellow. He has over 4 decades of experience working with some of the leading international agriculture development organizations as a research economist, a development practitioner, and senior manager. He has written 13 books and over 120 referee journal articles and book chapters on food policy. I give you Dr. Pengali.
Thank you, Patrick. Good morning, ladies and gentlemen. It's a great pleasure to be here in Chicago and at the Chicago Council and participating in this dialogue with the Institute for Agriculture and Health. I totally subscribe to Patrick Stover's call for a more responsive agriculture. I think that's the way forward as we think about how to make agriculture work for better health. But I think there's a really crucial aspect that we need to address as we think about this change. What we need to think about is how do we reimagine food and agriculture policy? Because without fundamental changes in food and agriculture policy, we are not going to get to a more responsive agriculture. Over the past half a century, and even before that, we've seen dramatic changes taking place to our food system. The dramatic changes that took place with essentially the elimination of famines around the world and the dramatic reduction in hunger around the world. That's something we should all be proud about. And that happened not just because of available technology, but it also happened because of a very proactive policy environment that promoted increasing the productivity of staple grains, increasing the pile of grain, not just in the US, but around the world. And that then changed the hunger scenario around the world and brought down the numbers of hungry. But it also created a permanent change in the food system itself. It made the food system much narrower. It made the food system much more calorie dense and much less nutrient dense. And the diversity of the food system was affected. And that change continues to be there today. And unless you see a change in the way we think about food and agriculture policy, unless we think about the way in which we create incentives for farmers to diversify their production systems and invest in more nutrient-rich crops, we'll continue to see ourselves lagging behind. But the transition itself is very difficult. The transition from a commodity-based agriculture to a more diversified agriculture is fraught with constraints. It's fraught with political economy constraints. As you remove the benefits that grain farmers are enjoying today, there will be political economy issues that come up. There's infrastructure constraints. And these constraints are ones that we see in the developing world as we try to promote a better food system in the developing world. But I see parallels to that when you look at developed countries like the US, etc. So these are issues that many of us have been thinking about, and all of us in this room will be addressing for the rest of the day. Much of the discussion on transitioning to a more healthy diet is a discussion on what is a healthy diet, but not a discussion on how do you get to a healthy diet. The very famous Eat Lancet report provided global guidelines on healthy diets. But the guidelines once you try to put them into practice, it turns out that they're not affordable and they're not accessible to the poor. So much of the poor in the developing world are at diets that are so far below the Eat Lancet level that getting to the Eat Lancet level is going to be an enormous challenge. My team at Cornell did an assessment of what it takes to get to an Eat Lancet diet for the rural poor in India. Today, an average rural poor household, individual, diet costs around $50. To get to the Eat Lancet diet, it costs $3. So that's your challenge. How do you reduce that gap? It's the same thing in the US. The US dietary guidelines are very clear on what is a good diet. But that dietary guidelines, that diet, is not affordable to the poor in the US, and especially to people of color in the US. Again, it's a question of how do you reduce that gap? And I think part of the way one thinks about it is to think about not just one diet, not just one solution, but to think about diversity of solutions out there. But the other way to think about it is how do you enhance the productivity of the food system? How do you enhance the diversity of the food system in order to make it more accessible, in order to make it more affordable? And that's the big challenge. So when you try to do that, you very quickly run into a set of market failures, a set of market failures that prevent the supply of diversity from meeting the demand. And so you see this gap between them, and therefore you see the problem of poor access and poor affordability of these diets. So think about it. In the US, despite the enormous progress in the food system, you still have food deserts. Food deserts in the inner cities, food deserts in rural communities, etc., and consumers in these areas not having access to nutritious, perishable food. And how do you get beyond that? How do you create incentives for agribusiness, incentives for supermarket chains, etc., to bridge that gap? That's been a big challenge. And because of that challenge, you find the relative prices of fresh food to be so much higher than processed food. And therefore, it's not a surprise that much of the problem of obesity and non-communicable diseases are much more prevalent in poorer communities than in the richer communities. And that's something we see here, but we're beginning to see the same situation happening in the developing world also. In the developing world, as we try to promote a better food system, we run into constraints around poor market infrastructure, around poor value chain investments, around high transactions costs for farmers to connect into markets, the very high costs of meeting the quality requirements, the safety requirements, the quantity requirements, the timeliness requirements for meeting market demands, for meeting value chain demands. And the high price volatility, the boom and bust cycles that you see in high-value vegetable production, fruit production systems, etc. Again, because of overall lack of infrastructure, overall lack of value chain investments, etc. And these are areas that one needs to address if we want to get to a better food system. I think food policy and agriculture policy has to play a big role. And here are ways that I think about it. I think the fundamental way in which one thinks about the future food policy is one that moves away from commodity-specific agriculture policy to a policy that's much more crop neutral, that allows farmers to have the incentives to respond to market signals. So create the infrastructure needed, create the resources that are necessary in order for farmers to respond to markets and the demand for markets. Invest in value chain infrastructure. Create a more transparent quality standards, safety standards, and create mechanisms for small farms to connect up to this. And find a balance between local and global food systems. One cannot just go local, one cannot just go global, but creating that balance allows you to have uniform supplies throughout the year and to manage price volatility. My final point, the safety net programs, food-based support programs, the SNAP programs in the US, the subsidized food programs in many developing countries. Much of these programs are very much tied to commodities. How do you create a more nutrition-sensitive food-based safety net programs? That's a big part of the challenge as we look ahead and a big part of the food policy that needs to be in place. I think if we can get the food policy right, then we can repurpose agriculture for better health. Thank you very much.
Thank you very much, Dr. Pingali. So our third panelist, who I'd like to introduce now, is Ellen Shantley, who is currently president of the American Academy of Nutrition and Dietetics. And remember, dietitians are the front line between all nutrition science and every consumer. Ellen is a lecturer in the Department of Allied Health Sciences and director of the dietetics program. So she is a registered dietitian with an MBA and is a fellow of the Academy of Nutrition and Dietetics. Her research program focuses on nutrition education outreach and food service systems management, with much of her work incorporating technology. Ms. Shantley is author of 3 books: Connecticut Cooks for Kids, Fueling the Teen Machine, and Overcoming Childhood Obesity. She has been actively involved in the Academy of Nutrition and Dietetics and is serving on its board of directors. She is the recipient of numerous awards, including the Academy's Medallion Award, the Academy of Nutrition and Dietetics Foundation's Award for Excellence in Dietetics Education, and the Outstanding Dietetic Educator in Area 7 Award. So please welcome Ellen Shantley.
Good morning, everyone. Thank you for having me represent the Academy of Nutrition and Dietetics at this meeting. The Academy represents more than 112,000 registered dietitian nutritionists and is the largest association of food and nutrition practitioners in the world. What differentiates from others is that Academy members have extensive formal education and training that provides expertise in all aspects of food and nutrition, and really enables us to play a key role in improving people's nutritional status to both prevent and treat chronic disease. The value of the RDN brings to the table is our experience in translating science and evidence, and in fact, the National Academies of Sciences, Engineering, and Medicine maintains that the registered dietitian is currently the single identifiable group of healthcare practitioners with standardized education, clinical training, continuing education, and national credentialing requirements necessary to be directly reimbursed as a provider of nutrition therapy. Let me start by stating there is a strong evidence that shows that nutrition security is key for ensuring adequate food consumption and achieving a healthy nutrition status at the household level. Guaranteeing equitable access to quality foods in sufficient quantities is essential for improving the well-being of the global population. Nutrition insecurity is tied to chronic disease, such as diabetes, cardiovascular disease, and obesity. This, coupled with a lack of nutrition services available to those who rely on Medicaid and Medicare, makes costly and clinically effective solutions missed opportunities to advance health. Currently, there are gaps that exist between policy recommendations and the ability to translate those recommendations into programs and investments, impacting food systems and ultimately food security. The effects of COVID-19 pandemic are translating into an increased number of food insecure people. The United Nations has estimated the impact has disproportionately affected women. The prevalence of moderate or severe food insecurity was 10% higher among women than men in 2020, compared to 6% in 2019. Here in the United States, the disparity continues to be seen in older Americans and people of color. The importance of understanding the pressure points and gaps between the food system and health has never been so vital. The Academy of Nutrition and Dietetics has a multi-level approach to addressing these issues, both across the lifespan of the population and at all levels of influence. This is from educating membership, spearheading and partnering on research initiatives, and advocating for key legislation, including the upcoming Farm Bill and Child Nutrition Reauthorization. The Academy was thrilled to see the inclusion of healthy school meals for all in the recent Biden-Harris National Strategy for Hunger, Nutrition, and Health. This has been a priority of the Academy for several years, given the connection between access to school meals and academic, community, economic, health, and equity benefits. Schools are the healthiest place to eat for kids, just like textbooks and support for learning environment. Access to meals should be available for every student. The Academy's Farm Bill recommendations and advocacy address nutrition security, a diverse workforce, and support for a health and sustainable food system. Examples in our goal to support nutrition security and health equity, improve access to healthful and culturally appropriate foods and resources to prepare them include funding for a new nationwide training and technical assistance resource center, doubling SNAP-Ed funding, reducing barriers, increase access to healthy foods, modernization through technology, and increasing access to incentives for fresh fruits and vegetables for SNAP beneficiaries. Our goal is to create a diverse workforce and ensure sound science and program evaluation for future evidence-based decision-making is promoting health equity and advocacy. Finally, our support for a healthy and sustainable food system include recommendations for funding community-based and regional agriculture and food access initiatives, increased funding for the specialty crop block grants to support food safety, and supply chain innovation for food retail outlets. We really do need to start children out at the right point in time, and universal school meals, healthy school meals for all, I think is really the way to do it. Tufts published a study in 2021 that really said that the best place for kids to eat the healthiest meals are in those school meals. And we know that lack of food security disproportionately affects low-income individuals, Black and Latinx children. In 2020, a research-focused task force released a methods paper and report of the Academy's research priorities. This work was led by member leaders with a wide range of experience, and the chair was Dr. Jennifer Garner from The Ohio State University. There are two items that really relate to our talk today, and that is a gap between the science policy and in terms of implementation of the science and public health. Within the public health domain, the top priority was to assess the multidirectional relationship between food systems, including various food production, processing, and distribution practices, and nutrition health outcomes. So if we drill down a little bit, let's talk, we need more research, absolutely. We need to evaluate innovative approaches to improve the system and understanding its impact on food security, nutrition, and health. and understand the impact of current and potential food systems practices on food availability, affordability, access, and diet quality. There are many gaps in evidence. The Academy is continually advocating for both increased funding to fill these gaps, but also for programming, which is needed to ensure nutrition security and health equity. By doing this, we can improve access to healthful and culturally appropriate foods and resources to prepare them. The Academy has 4 priority policy initiatives that align with the Academy's strategic plan. The first is strongly support of nutrition security and food safety programs, including the Nutrition Education for the Public and Nutrition Services Program, SNAP-Ed, the Expanded Food and Nutrition Education Program, the Supplemental Nutrition Assistance Program, and the Older American Acts Program, and there are many more. Part of the priority of the Academy is to advocate for healthy and sustainable food systems. And this includes funding and federal support for a variety of community-based regional initiatives. We really need to make sure that we collect the data, that we are then able to incentivize healthier food purchases. And this will help us evaluate data. An example of an Academy study which aligns with this policy priority is a Food as Medicine in Retail Registry. And this study is funded through the Academy's Foundation and General Mills Foundation. In this study, we're testing the feasibility of measuring the effectiveness of a Food as Medicine program and medical nutrition therapy by an RTN in the retail setting. Research such as this feasibility support our policy efforts and link food and health outcomes. SNAP-Ed is another important priority for us. I think we also need to make sure that we remember that the dietary guidelines for Americans are a major focus for the Academy, and we base our recommendations on robust science. Our members are stewards for translating complex information and implementation by the public. So there is a true connection between agriculture, food, and nutrition and the dietary guidelines. There is a robust pipeline between research and policy that helps move the mission and vision of the Academy forward, filling in the research gaps, ensuring that equitable access to healthy foods for all in a world where all people thrive through the transformative power of food and nutrition. Thank you.
Hanging out. You can sit.
Thank you. Well, welcome back, everyone. I hope that you've all enjoyed the event so far. So now we're going to start a panel discussion. I'll be asking questions of our panelists here and then open it up to questions from all of you. But before we begin, I want to introduce our third panel member here, Dan Gustafson, who is Special Representative of the Food and Agriculture Organization's Director General. Prior to this role, he was Deputy Director General for FAO, where he oversaw the work of the organization to ensure that it contributes to its members' sustainable development goals. As the Deputy Director of General Operations, he also oversaw the organization's decentralized offices and other operations related to departments and units. He has worked for over 40 years on agriculture and rural development issues. Welcome, Dan, to the panel. Very good. So I'd like to begin with a question to all of the panel members, and you can proceed as you like. Maybe we could start here and go down the chain. But we have defined responsive agriculture today. And by definition, it prioritizes human health. But that goal can only be achieved if the economics and the environmental considerations are aligned. Are trade-offs between economics, environment, and health inevitable, or can they be brought into harmony?
Thanks for that question. I think ideally we can bring them into harmony, but I think we probably will need some subsidies to do that. I think that we need to make agriculture affordable for people. And we know that fresh fruits and vegetables are really good, and if people would eat more of those, that would absolutely help. So somehow we do have to, I think, incentivize the eating of fruits and vegetables.
Thank you very much. Prabhu, thoughts on that?
So the trade-offs between agriculture, environment, and health are inevitable, but I think it's possible to reduce the trade-offs. I always think that smart farming is good both from a profit point of view, but also an environmental point of view. So precision agriculture, conservation agriculture, etc., can reduce climate impacts while minimizing productivity trade-offs. Now, if you then add on to that the ability to be more crop neutral in agriculture policy, then you can reduce that health trade-off also by improving the crop mix and diversity of the crops.
Thank you.
So it's possible.
Building on what the colleague said, I think it's exactly right. I think to a large extent, trade-offs are in fact inevitable because resources are always scarce and there are competing uses for whatever it would be, either in a policy sense, in government financing, and what industries invest in, what consumers are going to do. So difficult decisions are going to have to be made, but and they will, I think, inevitably involve some trade-offs in order to achieve what we hope to achieve. But as the colleagues have mentioned, I think this can be done in harmony. It's what we're really looking for, how to harmonize in spite of these challenges.
Very good. Thank you. We heard a lot this morning about the need for incentives and the need for a different way of looking at policy when we consider the outcome of health. And as we talk about shifting the endpoint from hunger to health, understanding that hunger is embedded within health, so you're not changing anything, you're just expanding the goal, if you will. The question is, how far along are all the actors and players across the food system? How much do they have a shared understanding of this goal and a shared willingness, if you will, to engage in that goal? Do you want to start with that, Dan?
Okay, thanks. No, it's I think a challenging question. I think there is, at this point, quite a a good understanding that the way that we produce, the way that we consume, has really profound implications for health of people, health of plants, animals, health of the planet. So in terms of an understanding that this is where we need to go, I think we're pretty far along on that. I think the complications come, as you mentioned, in that the kind of the policy domains of each of those are really quite separate, right? I mean, the health policy, environment, agriculture, food, and they are busy with those policies. So how to get this to, again, be seen in terms of a system leading towards that outcome is the challenge.
Prabhu, I'm going to ask you to answer that, but address something that Dan said, because there was a conversation at the National Academies a few months ago that you reminded me of, and that is, can you address that also in the context of how do we bring ag economics and healthcare economics into better alignment as well, which is part of the problem?
Yeah. No, I completely agree with Dan that there is serious sectoral interest here. I mean, much of the discussion on better diets and healthier diets comes from the nutrition community, and the agriculture community hasn't been very actively involved in this. And it just, at this stage, we are slowly seeing the agriculture community coming into the play, but the agriculture community continues to be very much behind in all of these discussions. And that's a big problem. The other problem that we see is the donor community in itself is not completely bought in. So every time you have a discussion with the large donor communities on, okay, we need to transition from a commodity-based research system to a more nutrition-sensitive research system, you inevitably get a big pushback. And so a lot of the donor funding is still used to increase the pile of grain rather than improve the nutritive value of the food system. And that's a challenge, I think, that we need to be addressing. The agricultural economics community has also been behind relative to the health community. But I think part of the reason for both sides not bridging the gap is the health community has been thinking of this very much from this is what should happen, but not about how should it happen. And the agriculture community hasn't been worrying about what should happen, but what are the constraints. And so that's where I think the gap needs to be bridged.
Can I challenge you on one point on this? You mentioned that, by and large in these discussions of having nutrition-sensitive agriculture, that the agriculture sector hasn't been as engaged. Is it that they haven't been as engaged or they haven't been invited to engage? They haven't had a seat at the table?
I think it can be both. When I talk about the agriculture community, I'm also thinking about the farm community.
Okay.
And the farm community, given the continued emphasis on stable grains, hasn't really had an incentive to change behaviors, change cropping systems, etc. So that's part of the engagement that's lacking. But the scientific community, I don't think has been invited enough into the discussions on agriculture and health.
So Ellen, looking at this from the perspective of, the practice of dietetics and the interface with the public, do you see buy-in across the whole food system for responsive agriculture?
I think there is buy-in, but I do think we have to sort of connect the dots for people. I think that we know that the agriculture is producing the food, but then we need to be able to get the food to the individuals where they want it. And we know there are food deserts, there are many rural areas that don't really have that connection. And we also have to educate the public. We need to make sure that people really understand what is important. And I think we have to have buy-in that prevention is going to really save us money in the end. So, we have all of these people with chronic diseases, but isn't it better to prevent them from the start?
Exactly.
And sometimes that really costs money to do. But I think that's really, really important.
Okay, well, very good, thank you. Any of you who would like to ask a question of the panel, you can begin to line up at any time, and I will go through some of the scripted questions we have, but happy to take questions from the audience as well, and the microphone is located right there in that corner right there. So thank you. Well, when we talk about gaps, whether they are in knowledge or in technologies or in other types of fundamental research, where do you see the major gaps of knowledge we need in order to achieve responsive agriculture?
I think that in all the areas that were mentioned this morning, actually by all the speakers, a lot of what's going on, more of that is of course necessary. But I think what is a very high priority is to look at things in a more from a more of a systems perspective, that innovations, research, science innovations that are not kind of unidimensional, but that in fact work towards these kind of multiple objectives at the same time, which is, I think, really, you encapsulated very well in the presentation of both responsive agriculture and what agriculture is the solution for health. So all the work in science, agriculture, social science, nutrition, environmental, health sciences, and so on, all good, but how do we get innovations that cut across those that are hard to find? I think that would, to me, would be the priority.
Okay, thank you. Prabhu?
Yeah, I definitely agree with Dan's comments. I would also add that from a research point of view, there's a lot more that needs to be done in agriculture research. Improving productivity and stability of perishable products, vegetables, fruit, etc., is an area that hasn't had as much attention as for commodities. Second, research on food safety is crucial. And unless you get food safety right, you can't build those value chains for perishables. And we need those investments.
Very good. Ellen, do you have a comment on this?
You know, I totally agree with everything that they've said. I do think we need to have much more research in place, and we need to see where we can go and how we can make those changes efficiently.
Very good. Thank you. Well,
There's a lady over there.
let's pivot a little bit to best practices, and I will address this to our colleagues here who have really been active over the years in the international community. But what lessons have we learned from international agriculture initiatives that addressed hunger that can apply or translate into the U.S. as we try to address human health? Are there lessons learned there?
Yeah, there are a lot, I think. First, maybe it's very clear, and it's worth reiterating how much of an impact science, technology, research, extension has had on addressing your first slide, right, which remains the priority in still lots of countries on avoiding or eradicating hunger through more efficient production of cereals and so on. But when we look at instances where there were big jumps in reduction in nutrition or malnutrition and other problems, to me, what stands out is, in fact, political commitment and a prioritization that this is really what we have to do. And there are a number of countries come to mind. I think of Peru, for example, and I'm sure some of you know this story, went along for many years without much progress in child malnutrition. And then essentially they got serious and made really good progress. Also, Prabhu knows this story really well. We used to talk about the South Asia enigma, right? Why is it that child malnutrition, in particular in South Asia, is so bad in spite of all the other progress? And then not very many years ago, Bangladesh prioritized it, became serious, and made fantastic gains. And I think the difference there, to me, was really this question of political will, making it a priority, getting people together to work on it.
Very good, thank you. Prabhu?
Yeah. So the political will of making things happen, there's some good cases of that. But there are also cases where political will did not happen. And so you saw a breakdown of the political support for policy change. For example, India tried to liberalize its markets and to sort of move away from a very strict public procurement for the public distribution system, etc. And then what happened? You saw a big backlash to that. Mm-hmm. And so then people sort of go back and say, maybe we won't go that far. And that's trying to figure out how to get beyond these political economy problems has been a big challenge. And I think trying to understand how the US and other countries have done that better or not is something that we can learn back into the developing world.
So the point that's been made here, I mean, we have had these major international initiatives that have made great strides in certain countries to eliminate that goal of trying to tackle hunger. And we're hearing here from these experts that political will is really, really key. And so again, what I'd like all of you to comment on is, do we have that political will here in the United States? Do we have buy-in across the ag value chain from all these sectors that are essential to achieve that will to get to that human health outcome? So please comment on that, and I'll ask the gentleman here at the microphone to ask a question.
Hi, my name's Eduardo Sanchez. I'm just a doc from Texas, and I feel really intimidated by this group here. What I came up to ask about y'all's commenting on was segued, if that's a word. Y'all created the segue, the pathway, was about the geopolitical variables that are playing themselves out today, which was mentioned, but it seems to me can and should be a thing to anticipate, prepare for, plan for, and study, one. And then I would just say, I don't think that there's consensus on political will. I think there's pockets of political will, even in the United States, and pockets of no political will in the United States by geography, by sector. But I also think that as this group considers the work in the future, tracking, monitoring, describing, and having a research agenda around the political systems and policy making would be really, really valuable across country, across countries, and within communities. So I would love y'all to talk a little bit, though, about the geopolitical realities that have become quite evident with grain supply at a stranglehold by one human being's decision to do or not do certain things. How do we avoid finding ourselves in that situation if we pursue agriculture for health?
Any of our panelists like to comment on that?
Well,
He's an FAO man.
yeah, in sort of 10 words or less, right? I think it's important. Clearly, what you say is exactly right, but I think it's also important to kind of step back. We are going in the wrong direction on reducing hunger. Again, not thinking of healthy diets, which is in cost terms, as you pointed out, really Jessica pointed out, out of reach for probably 3 billion people. But even on the basic caloric minimum energy supply, we've been going backwards since before COVID internationally. And that's bad news, really. We were making progress for a long time. We stopped making progress even before COVID, and of course, COVID was a huge impact on that. So the current situation, certainly the Ukraine shipment blockage, fertilizer is going to be a big story for a long time, including next year. But I think not to lose sight of the fact that globally we are going backwards in and need to reverse that trend. And a lot of that has to do with conflict. A lot of it has to do with more extreme climate events. And those are really pre-existing conditions that are going to be with us for some time outside of the current context.
Excellent. Thank you.
Can I make this one?
Please, please.
I think one thing that worries me about the Ukraine conflict and the implications for food trade and food supplies is that you may see a reverse of going back to saying we need more support for commodity grains rather than for diversification. So we may be pushing the agriculture health agenda lower in priorities because of that.
Good point.
Good point. Absolutely. So we have Catherine.
Thank you. Yes, the mic is getting adjusted for height challenged. Well, now I'm ruining it altogether. I've moved it up now. I'll just hold it. Three points. One is the White House conference that Alan mentioned. We haven't talked much about that, but I'm wondering if there's any hooks that came out of that could be used to promote different pieces of what, Patrick, you end up deciding is important to promote. And there wasn't much about that at all, which I don't necessarily think is a bad thing, because I think it might be politicized because of the timing of when that conference was. So maybe after the election would be time to pounce on it from a policy and political perspective on some of the items that were mentioned. But I hope some of the ideas go further than reaching SNAP beneficiaries differently or increasing SNAP ad, because to me, we need more involvement of SNAP beneficiaries in the local policies and the local hunger groups and the access to food banks and other programs that are available in the counties. And that's one of the things that I see is lacking, that we're still top down, even if we're the people working in the county social services groups, we're still not. We still don't have the people at the table that are really getting the benefits. So that's one point I wanted to make. The Ukraine also, Prabhu, it does directly relate to farmers in the U.S., right? Because, wheat prices are up because the ports are blocked. Wheat prices went down because the ports are open. Now ports are blocked, wheat prices up. I mean, how this is going to go on for a long time, and it could potentially impact on other agriculture policies that we're trying to put together. And then my final two are just thoughts about putting policy together. And they come from my experience now 30 years ago as Assistant Secretary at USDA, charged with the domestic food programs. But especially with the WIC program, we learned some interesting things that I want to pass on. Because when we think about, for instance, what should be our policy, what should be our broader policies as it relates to nutrition, is there this political base and to work for that? I think we need to be thinking about, I'll get to the WIC part in a minute, but I think we need to be thinking about what is our direction to the American people? What are we saying is good for people to eat? And then what are we doing about making sure that that's available? And how are we spending our money that we spend on agriculture as it relates to those programs? why don't we put more resources into fruits and vegetables if we think that those are really important part of the diet? And how do we justify what we put in, sorry folks, but how do we justify what we put into the traditional crops if their consumption is not necessarily what we're proposing? So what happened with the WIC program that I think is relevant is we found out that while we were saying breastfeed, 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 we were giving out free formula. Now, we weren't so stupid to think we could cut out the free formula, but instead we created breastfeeding packages, food packages for breastfeeding moms. So it was an add-on, not a takeaway, and we got to actually live what we said rather than say one thing and then ignore it. So just an example as a thought. And finally, when you talked so compelling, Patrick, about diabetes and the amount of money we spend on diabetes treatment, on what we lose from diabetes, on deaths from diabetes, wouldn't it be great if you could take those costs and go back to the science and the background as you and Jess talked about, and compare those costs to what it would cost, once you figure out what it is, of course, what it would cost to have a healthy diet for every American, and what part the government would play in that, and then compare the two. You know, we spend this many billions of dollars on diabetes, but if we only spent this much, we could save this much on diabetes. And that worked, again, years ago with WIC, before it was national, and before people thought it was going to be national. And we were able to have research done comparing WIC mothers giving birth with mothers who were income eligible for WIC but not on WIC giving birth. And the babies were healthier, bottom line, of the WIC mothers. And we were able to say how much healthcare costs were involved in the babies who weren't so healthy. So we were able to say, for every dollar you spend on WIC, you'll save this much on Medicaid. And it worked, and that was cross-purpose because WIC money was out of a totally different pot than Medicaid money. So anyway, I just pass that on to say we got it. I think if we do some things like that, we'll convince people that may otherwise don't care or may not prioritize it on the Hill that actually this is an investment worth doing. Thank you. I'm sorry for the length.
Very compelling comments. Does anybody want to react to anything that's been said here?
So I would just say that the White House conference, I think, was really just a starting point. I last week was at 2 meetings afterwards, one by USDA and the other with FMI and Tufts University. So I think that people really are mobilizing and figuring out what we can do, how we can really advance the story and make sure we do make a difference in the future. At the USDA, I'm going to say there was a huge emphasis on healthy school meals for all. Again, I think starting those kids out on the right track. So I think that is something that might be feasible, might really happen, which would be excellent. They also talked a lot about medically tailored meals and how we can improve what we're giving to people so that it fits with their disease state. We also really need to think about medical nutrition therapy, that it would be much cheaper if we could treat people before they had the diseases. Right now, there's no reimbursement for prediabetes, right? So you can't see a registered dietitian nutritionist unless you can pay for it out of pocket. So that would save a huge amount of money.
And I mean, this is part of the challenge, and I think we need to differentiate here. So right now we have, half the U.S. population having a chronic disease. And so what is the solution in terms of food to deal with a population that's not healthy? And we derive all of our dietary guidance assuming a healthy population, and that's a big issue. But back to Catherine's point, we need to say, well, how can we avoid those externalities and that chronic disease in the first place? How do we make the investments in agriculture so we don't have to deal with this problem of half the population being sick, which is driven by food? What are the necessary investments? Does the healthcare economics and the investments needed in the agriculture economics make sense so that we can actually not only improve the human condition here for everyone, but also save money, right? And that's where we really have to bring these two, bridge that chasm, as Dr. Stark-Fried likes to say, between the producer and the consumer. It happens at all levels, levels of economics, of public trust, and everything else. Everything has to make sense. Everything has to work together. And again, agriculture has to have a seat at the table. That's what's absolutely critical. Yes, we need to deal with the sick populations we have now, but let's try to get beyond that so we don't keep feeding that pipeline of unhealthy adults. Could we have another question?
Hi, my name is Jack Bobo, shaped by the environment in which they find themselves. And so there was a little bit of a mention in the White House conference of the role of the food environment, but how do we really elevate that? Because when I think about a nutritious future, I don't want to be taking a pill to make me healthier. I don't want to be counting calories because I'm lazy. I'd rather my food environment do the work for me. You know, nobody knew anything about health and nutrition in 1960, and nobody was obese. We were cooking with lard, and so anyway, I'm just curious, you know, one about that demand side and how we can shift our environment to help deliver those outcomes.
And I'll add one point to this, and then definitely an important point, because consumers are a major driver, you know, in the reverse direction of what the whole ag and food value chain looks like. I had a conversation with a leading CEO of a major grocery company who talked about how every 6 months when they reassign shelf space, and shelf space is huge in a grocery market, food in a box continues to lose space. So the consumer is getting that message, but how do we accelerate that? But I turn this over for comments to those who are more knowledgeable than I.
Yeah, it's I think a great point, and I think it kind of tying the two last questions together a little bit. I mean, the issue is that, you know, we have kind of private beneficiaries or let's say in a system that works really quite well, and farmers are producing and companies are producing and meeting consumer demand and so on, but the cost burden is really public because of these enormous costs to society of diabetes, obesity, and the other things. And how to align the system or the policies and let's say government spending and other things in a way that kind of accommodates those two parts of the equation is, I think, the real challenge, and it's something I think that's going to come out in the work. But I think it's a critical point.
I think food as medicine is another part of this. You know, we talk more and more about food as medicine and getting a food prescription for something. It may be at a food bank, it may be in the grocery store, whatever it may be. But I think that we do need to encourage people to eat healthier foods. And that is one potential way of doing it, because I think the economics have to be there as well. So people then, if they're getting this food for free, they're going to more likely eat it.
And let me ask you a follow-up question on that. I mean, I talked about the issue of public trust and sort of the many dimensions of trust all across the ag value chain. And that one Pew report where there was not, you know, strong trust in nutrition science research. What I didn't say is that there is strong trust in nutrition professionals, in dietitians who give advice. So that trusted relationship is there. How can we turn that into more consumer demand? And clearly, again, we're seeing that at least at the supermarket level to some degree, but how do we begin to accelerate that?
Well, I think it is having food companies be involved by hiring more registered dietitian nutritionists to be involved. I think we could really expand the number of dietitians that we see in supermarkets. You know, some are better than others in terms of what they do. But I think it is making that connection between that customer and that registered dietitian. IFIC did a survey, and the number one person for trusted nutrition information is the registered dietitian nutritionist.
Absolutely. Thank you. Probably.
Just a quick comment. You know, there's a lot of information on behavior change and what's good diets, etc. But it's very complex for consumers to absorb that and then say, okay, this is how I'm going to change my behavior. The one example of a really positive way in which this happened was a few years ago, there was this Got Milk commercial. You remember all people like Bill Gates, etc., having milk mustache? That had a huge impact. Now, can you come up with that type of simple messaging that has broad scale appeal, which then changes behavior and changes demand?
Yes, there's a huge marketing dimension to this. Absolutely. Please.
Thank you. Good morning. I'm Tim Griffin. I'm from the Friedman School at Tufts. And I'm at the very beginning, Patrick, you gave us the grand challenge, the ultimate challenge here. And I agree with that. And then you just raised another one, because a challenge that's very obvious from the comments we've heard already is, how do you work across all of these different interests at the same time, including agriculture? And I come to this very much from the agriculture side. But I also tend to think in kind of concrete terms. And what I'm wondering for the panel, but also people in the audience, is, Patrick, you just mentioned that agriculture needs to be at the table here. I agree with that very much. Are there examples, policy examples, practitioner examples, that we can look to now that is already happening? Otherwise, my concern is that it's a bit more abstracted than to be able to take action. And from where I sit and what I do see some examples of this, where there is, fairly cohesive interactions between agriculture to consumers and then thinking about health, maybe not measuring outcomes. But I'm just curious if others have examples of that across sectors or at different scales. For example, is there a successful state program somewhere in the US that's doing this? So, thank you.
Comments to that?
Go ahead.
I think the biofortification program is a really good example of how agricultural scientists try to address health issues, and specific health issues, so iron deficiency, zinc deficiency, etc., by using crop breeding as a way to enhance the nutritive value of crops. And now I think the technology side of that happened very well, but the dissemination hasn't been as good, I think. But that's one example that immediately comes to mind.
And I think there are other examples in hunger as an endpoint where you have had strong collaboration across many sectors to get to that point. One example that I can think of that I know is problematic, and when there were a lot of efforts for sodium reduction. It was voluntary. Those who reduced sodium in their products lost sales. Those who didn't, did not. And so it goes back to there has to be a policy dimension to this as well. And again, you have to do it in a way, right, that respects the autonomy of the consumer. And I think that's the challenge. I would like to know some of the examples which you didn't tell us, which you said that you've thought of, but maybe you could do that later.
Could I add to that, Patrick?
Please.
Okay, just to add a bit of a different dimension to it, since it's part of the responsive agriculture definition on agriculture's role in let's say, planetary health. And there, I think, we have seen a lot of interest, and including and maybe especially in the U.S. in conservation agriculture and no-till and other things, and a lot of other things actually, where production practices have changed to utilize fewer inputs, to be more, to lead to greater long-term sustainability and so on. So on the environmental side, I think the agriculture community has been there are lots of examples. I think also in the case of climate change and methane emissions from livestock sector and other, where I think the industry has kind of been the lead on this. So I think on the environmental side, I can think of examples there too. Yeah.
Very good, thank you.
Hi, my name is Stefan Van Vliet. I'm the assistant professor of nutrition with Utah State University. I had a question. What maybe the panel sees as worthwhile strategies to get farmers more involved in policy making. In a lot of our work, we work directly with farmers, and we see things on the ground of farmers who are improving maybe plant diversity, biodiversity, bird populations, but things that are hard to capture for us as academics sometimes in scientific studies, right? And within policymaking, we do obviously ask, well, show me the evidence. And I'm guilty of that too, when I'm on the farm and see, oh, yeah, looks great, but show me the evidence. But usually it's part of a sort of a grassroots movement where apparently they are making these improvements. So how do we get maybe farmers more involved in policy making on that level as well?
Yes, and so this gets in somewhat into the area of barriers as well, but we've talked a lot about incentives and so forth and so on. But how do we bring all the sectors along this journey, including those farmers and those producers? How do you get that multi-sectorial engagement and buy-in? Please.
To kind of, let's say, bridge both those, I think the U.S., in looking at other experiences too, has been exemplary in getting farmer input in the research agenda, but largely in traditional corn, soybeans, wheat, and also in the fruits and vegetables specialty crop sector. But of course, the specialty crop sector has not had the same level of funding. So the way, and Texas A&M way out in front on this, on how to get producer input into the research agenda on parts of the research agenda is really strong. But the overall direction of that input on issues that would put agriculture as the solution as we're looking for, I think is not as strong. But
Absolutely. And again, when and we haven't had a lot of producers up here at the microphone. We've had a lot of academics up at the microphone. But some of my producer friends out there, some of the room here, they are business people. They need to make business decisions, and they have to be risk adverse. They're in a tremendously risky enterprise. Again, with low margins and all the constant threats that you have across the board in being able to be profitable. And so how do we overcome that? How do we get the buy-in? How do we get the incentives? How do we create that comfortable space where we can think about doing things differently than we've done them in the past? And I'd love to hear from some of the producer groups on that. Please.
Hi, thank you. Carmen Biker-Shanks from the Gretchen Swanson Center for Nutrition. The Gretchen Swanson Center for Nutrition leads the GUSNIP NTAE, which is the National Evaluation of Nutrition Incentives and Produce Prescriptions. And there's been a lot of comments on nutrition incentives and produce prescriptions and their promise and potential in regards to human health. So just wanted to make a few comments from our perspective of evaluating 182 programs across the U.S. that are implementing either nutrition incentive or produce prescription programs. The first point is that these have received bipartisan support. There's a lot of momentum right now behind nutrition incentives and produce prescriptions. There's funding from GUSNIP, GUS COVID Relief and Response, and ARPA, and the field is growing substantially. From an evaluation perspective, we are grantees that are awarded are required to collect data to research the effectiveness of these projects. And so I did want to comment about, from a metrics perspective, when thinking through agriculture for health, ensuring that metrics that monitor outcomes around participants don't overburden the participants that are involved, especially when it comes to safety net programs. What we hear over and over from programs across the nation are that participants feel like they're over-evaluated, they're asked the same questions over and over again, and they're just trying to access food that's actually a human right. And it's one more barrier to being involved in these programs is being constantly evaluated by them in any social service that they participate in. There are really innovative ways to collect outcome data that isn't constantly involving, the participant themselves. So one example of this is the integration of electronic health record data and interfacing programs in healthcare settings where the electronic healthcare data can be pulled. And I was at the USDA Nutrition Security and Healthcare Summit last week where there was a lot of talk about the electronic healthcare record, and there are some barriers in that technology. And so I think thinking really practically around how can these systems talk to each other? How can we use them, leverage them in research and programs so that we are decreasing the burden for participation? And so just an overarching thought from our experience. Thanks.
Thank you. That's very, very helpful. And those programs, again, are so critical. We see, that the greatest burden of diet-related chronic disease is among the populations that these programs are targeted to, and that's absolutely critical. And there's that trade-off, right? We need, and I know we have other experts in this area, we need the data to do the valuation so we have the good science to show that, in fact, it is a good return on investment and it does create healthier people. At the same time, there are those issues with that we have to get around, both with privacy, which I don't think you did speak to, but tying it to electronic health records, et cetera, so that it can be a more passive data collection. And really important points. Thank you. Did you want to comment?
I think technology is really important here because I do think that there is a lot of burden put on the consumer who's getting these things and being evaluated. But on the other hand, we do really have to have the evidence. We need to have those outcomes. And that really is very clearly indicated by insurance companies. So we really do need that evidence. But we have to really leverage our technology so we make it easy.
Ray?
Yes, I'm Ray Glahn. I'm a research scientist with the USDA ARS. And on a positive note, and also to point out an area I think where we're missing out a lot on an opportunity. We have great nutrition success stories. Speaking as someone who runs a team of ARS scientists working at that interface of ag nutrition, we're not doing a good enough job of getting out there, interacting with the producers and the growers who really want to be involved in nutrition. And these are things when I go to a meeting like with the Michigan bean growers and do some work with them, there's a lot of energy that resonates from that. And so, there's stories that we have that are success stories right now. And if we just do a better job with that, that's one of the first places I think we could start working on all of these issues.
Anybody want to comment on that?
Good idea. Yeah, I think it's an excellent suggestion. I was thinking also earlier about the USDA annual Outlook conference in the beginning of the year, which I hope is still meeting post-COVID, I suppose. But the kind of the interaction of the industry and producers and so on, and the ideas and so on, it's just always so energizing. I think it's just a great, there are opportunities, I think, for, like you mentioned, within existing, let's say, the events and so on, that I think we could take a lot more advantage of in this space.
Again, the bottom line is the economics have to make sense for the producer to have a health outcome, and that's at the end of the day is going to drive everything. And again, you're at that interface again of healthcare economics and ag economics. Please.
Hi, good morning. I'm Amy Myrdal Miller. I run Farmer's Daughter Consulting outside of Sacramento, California, and I wanted to share an anecdote from California about political will and incentives. I was part of a coalition that worked to defeat a piece of legislation this year that was brought forward by 5 Democratic Assembly members called the Child Nutrition Act of 2022. Sounds amazing, right? The act proposed two things of significance: to incentivize school districts across California who are now implementing universal free meals, to incentivize them with 30 cents, up to 30 cents additional funds from the state per meal if they gave an alternative to every animal-based ingredient with a plant-based ingredient. The second part of it was to provide a snack or breakfast for non-school-aged children to come into that school or to be taken home by an older sibling. And amazing, you know, food security for that age in California, more than 50% of 5-year-olds and younger are WIC eligible, so there's definite need for food security in that population. So I was brought in with the coalition to talk about the potential negative impact on nutrition security if this moved forward and schools who were eager for additional funding took that 30 cent per meals and students started shifting away from the more nutrient-rich animal source protein foods. And I stood in front of, well, via Zoom, right? Many legislative staffers, assembly members, senators. I testified in front of a Senate Education Committee, and it was like talking to houseplants because nobody wanted to defeat this bill. Everybody thought this was great. Consumers love plant-based. This is amazing for those younger students. We were finally able to find the political will in the governor's office to defeat the legislation on the incentive piece for plant-based by simply pointing out a lot of the alternative products weren't going to be grown in California. We don't have a huge pulses industry, legumes industry. And so even though like almond milk producers were super enthusiastic about the potential for almond milk to move in and replace dairy milk, many of them are closely aligned with the dairy industry. But the political will came from the governor's office to say this isn't good for California agriculture, it's going to have negative economic impact, and nobody seemed to care about the nutrition impact. So for me, it was a huge eye-opening lesson in where do you find the lever that's going to have an impact that's going to be positive for agriculture, positive for human health. So just sharing this to share my innocence. But you've presented so much that's ambitious here today. I am hopeful for the future, and I can't wait to see where we are at the end of the day.
Very good. Thank you. Comments on this? You know, and no, it is fascinating. Again, and I can't speak to exactly this case, but again, there are many preferences, values, beliefs within the food system. If we look, again, at recognizing if the goal of the food system is to promote human health, and we know that people respond differently than food, we need a highly diversified food system until we figure all of this out. And we just have to make sure that if health is the outcome, that we make decisions, or at least we give the scientific information to decision makers, those of us who are scientists, that help them make science-based decisions towards that goal of health.
Ross Wilson from Texas with the cattle and beef industry, and appreciate being a part of this discussion. Some great concepts. This is the discussion, the question on the table today about producer engagement in this dialogue is a bit analogous to the discussion on sustainable commodity food production that's occurred for the last 15 or so years. There was understandable skepticism and concern among producers at the beginning of that discussion as to, will this be based on economic reality and will it be based on science? As long as we can assure producers that that's the case, I think they're more than willing to be at the table and find a solution, be part of finding the solution. Dr. Stover, you mentioned economics, and you've mentioned repeatedly, which we appreciate, rigorous evidence-based science. Amy provided a good example when we go awry from that discussion and we don't have all of those pieces of the puzzle appropriately on the table. That's when producers get skeptical. I think producers are more than willing to come to the table and be a part of this solution.
Thank you. Any reaction to that?
Good.
No? Okay, very good. Thank you. Please.
Hello, everyone. I'm Clancy Harrison. I'm the founder of the Food Dignity Movement. And one of the things that we do is we hold a lot of focus groups around the United States with the consumer. During COVID alone, our team fed over 3 million meals running a large food pantry. And so I love this idea about nutrition and talking about policy, but unless people are actually consuming it, the nutrition doesn't mean anything. And it's really important for us to understand barriers to food access for people to consume them and making sure that we have that voice at the table. You know, just one story real quick, a policy that we worked with students at a VOTEC school. They did not want to have an on-site food pantry because they didn't want to fill out the TFAP form. They felt that they would be taken away to children and youth because it would identify that there's no food in the home. And that's a simple policy. How do we streamline policies to make food access? Also, there's a lot of food pantries that by the time they receive food, the produce, it's rotten. So how do we get the small farmers involved so we're getting nutrient-rich food that we're going to actually consume versus toss out? And the other thing, as a speaker and a consultant, I've learned people don't understand the definition of hunger, especially the private sector. So how do we change our language to ensure that we're speaking to the values and how hunger impacts their bottom line if we want to get them at the table? So thank you for this.
Thank you very, very much. And it really echoes points made earlier about investments have to be made in the infrastructure of the whole supply chain so that we can get all the types of food that people need to them, especially those that are perishable. And again, the issues of barriers is absolutely critical, understanding how we ensure that people do have that access with all the barriers that are out there, whether they be physical or others more political, as you mentioned. Thank you. Angela.
I'm Angela Young. I'm a faculty member at Cornell University, and I also work in Cornell Cooperative Extension, directing FNAP program in New York State. One of the comments is sort of a comment and question that I think is really important is the issue of equity. When we think about the burden in the U.S. specifically on people of color when it comes to chronic disease, and looking at their role in working within the food system, maybe not at the top, but from the standpoint of workers, in looking at just sort of the inequities that exist when it comes to food system work and also the burden of disease within the food system. But I think what's really exciting here is we have the potential to reimagine as we think about nutrition where we don't create gaps. And we don't create a system that might be only accessible to those that are more affluent and not those that are in the middle and also that are living where we have that economic inequality that exists. So one of the things that I just wanted to ask, where does equity fit in this conversation? And then also, when it comes to people of color working in the food system, how do we make sure that there is that equity that exists in workers' rights as well?
Absolutely. Does someone want to comment on that?
I think that's a really important issue because much of the global guidelines around what's good food, what's good diets, etc., doesn't take into account different levels of society and how to reach each of those levels. And you know, if you take the Eat Lancet, for example, it basically excludes the poorer populations. Yeah. And so we probably need to think about guidelines that are specific to different groups. And we can then work through each of those groups and say, how do you get that equity in the system? It's a really important issue. We haven't thought about it enough, I think.
And Angela, the point I would like to make with this again, and to emphasize, is that yes, the burden is disproportional in terms of the effects of diet-related chronic disease, and it has a devastating effect on families and communities. But everybody has to buy in because we're all sharing those healthcare costs. I mean, and so this is everyone's problems. It's not just a problem of the segments who are bearing the burden of the disease. It's disproportionate there. But everybody has a stake in this. So thank you very much for raising that.
Actually, can I just make
yes.
one additional
sure.
comment? The Rockefeller report on the true cost of the U.S. food system is an excellent piece of work because it addresses the environmental cost, the health cost, and the equity costs of the food system. And I think replicating that work in other places and even sub-regionally within the country would be very useful.
Ellen, you wanted to?
I was just going to say, I think equity is such an important issue, and I think we need to really meet people where they're at. And I think having culturally appropriate foods, not trying to change how someone's going to eat, but encourage healthier eating with what they want to eat. But yeah, health equity I think is a huge issue, and we need to have some of these programs to try to even the playing field a little bit.
Absolutely. And it holds true for faculty. I've been an academic administrator, and I can tell you, faculty don't like being told what to do, and I think people don't like being told what to eat. We have to improve the food environment within the cultural context. So with that, quick closing thoughts from anyone. They are telling us that it's time for break.
It's time for break.
Is it time for break? That's the closing word. Thank you all very much. It is time for break, but thank you all for the active engagement.
Thank you so much, Dr. Stover, and our esteemed panelists for joining us today. We've heard a lot about the importance of a systems approach and the challenges of ensuring a diverse, inclusive, and equitable food system, and how we really need a whole of society transdisciplinary approach to repurpose agriculture for better health. And that's a lot of food for thought. So with that, we're going to take a break, a short break, and we will resume at noon to hear from our lunch keynote speaker. So with that, please also join me again in thanking our moderator and our panelists for these excellent discussions. So thank you.
Very good. Well, while you are enjoying your lunch, I have the distinct honor and privilege of introducing Dr. Shavonda Jacobs-Young. There is no one who understands all of the dimensions of our agriculture and food system and is more committed to its success than Dr. Jacobs-Young. And fortunately for us, she serves as the U.S. Department of Agriculture's chief scientist, as its Undersecretary for Research, Education, and Economics, known as REE. The REE mission area is comprised of more than 8,500 employees across 5 organizations, including the Agriculture Research Service, the Economic Research Service, the National Agriculture Statistics Service, the National Institute of Food and Agriculture, and the Office of the Chief Scientist. Together, these organizations advance agricultural research, innovation, data, and extension, addressing agriculture's highest priorities across the entire U.S. food supply chain, such as climate-smart agriculture to nutrition security to food safety. Prior to being appointed by President Biden to serve as the REE Undersecretary, Dr. Jacobs-Young was the ARS Administrator for 8 years. She is a fellow of the American Association for the Advancement of Science and a member of the National Academy of Public Administration. She holds both master's and PhD degrees from North Carolina State University. So with that, please welcome Dr. Jacobs-Young.
Good afternoon, everyone. It's been a great morning. Good afternoon, everyone. I'm from Georgia, and so where they sit on the porch and wave at strangers, and so I need us to have a little bit of energy and please continue to enjoy your lunch. So I am so happy to be here and participate in today's event. It's a pleasure to speak with all of you and to hear the lively conversation that happened this morning. And Patrick, thank you for that wonderful and short introduction. I bring greetings and well wishes for a successful and enjoyable conference on behalf of Secretary Vilsack and my USDA colleagues. And I applaud the Chicago Council on Global Affairs and Texas A&M AgriLife Institute for advancing health through agriculture for hosting this important event. It follows on the heels of last month's outstanding conference on precision nutrition at Texas A&M by IHA. Food security and diet-related diseases are major policy questions governments around the world are attempting to address. The kind of work taking place at this conference will be crucial to advancing those efforts that all of those governments are working very hard to undertake. Tough as they are, the questions can't be solved in a vacuum. Solutions must balance human health, environmental health, and economic vitality. As we know from the pandemic, events in any one of these areas inevitably spill over into one or both of the others. And this is, in a nutshell, is what the conference calls the ultimate grand challenge. As policymakers, researchers, and program implementers, we must be mindful of the potential downstream and unintended consequences of every action we recommend and put into place. And as Patrick said, I am the Research, Education, and Economics Undersecretary and USDA Chief Scientist. And I'm very fortunate to have a holistic perspective on the issues because all of the 4 science and research agencies I lead and the Office of the Chief Scientist, we're all working together to really enhance the availability and affordability of healthy, nutritious food for all Americans within the broad framework with which this conference is concerned. For all of agriculture's scientific contributions, serious challenges remain. And we've heard this morning that the global population is expected to exceed 9 billion by 2050. And that's nearly 2 billion more mouths to feed, and only a little more than 17 years to figure out how to do so. Second, we are constantly fighting to protect agriculture against new and emerging pests and diseases that can result in billions of dollars of losses to production. Third, we're doing this work against the backdrop of climate change and the need to preserve the nation's natural resources. And we're preparing the next generation to lead the future of agriculture. While doing all of this, we are striving to educate Americans about health-promoting diet and lifestyle choices, and to ensure that our farmers and their associates remain financially viable. This all brings us to the theme of this meeting today: using scientific approaches for improving the health and well-being of all Americans through nutrition, and doing so in ways that are good for the environment, good for the economy, and impactful for all populations, including underserved communities. To help set the stage, I'd like to highlight two of President Biden's recent initiatives focused on the critical importance of food and agriculture, and on how dietary choices can have a major influence on our health and well-being. First is the Revitalized Cancer Moonshot, which aims to end cancer as we know it. Specifically, it sets out new goals that seek to reduce the death rate from cancer by at least 50% over the next 25 years, and to improve the experience of all the patients that we know and families living with and surviving cancer. The world of agriculture plays a key role in the Cancer Moonshot because we know that eating fruits, vegetables, grains, and other healthy foods can help lower the risk of certain types of cancer. Second, on September 28th, the White House held a conference on hunger, nutrition, and health to galvanize the public and private sectors toward reaching a goal of ending hunger and increasing healthy eating and physical activity by 2030. And we've heard a little bit about the conference this morning. So the aim of the conference is to have fewer Americans experience diet-related diseases while reducing health disparities at the same time. And the need for action is clear. Millions of Americans experience hunger or food insecurity, and millions more suffer from diet-related diseases such as type 2 diabetes, obesity, hypertension, and certain cancers. Diet-related diseases, as we heard this morning, are a leading cause of illness and death in the U.S., and their burden is disproportionately impacting communities of color, those in rural areas, and individuals with disabilities. Addressing these complex issues requires transformative programs, policies, and system changes within and outside of government to create equitable environments that allow all people to thrive. All people to thrive. In response to these challenges, a national strategy was released, outlining the Biden-Harris administration's pledge to make progress on nutrition security and diet-related diseases. Now, the plan can't provide all of the answers. No one document can do that, of course. Rather, it strives to set us on a path to achieve the president's goals by identifying key federal actions that are ambitious, achievable, and durable, as well as by inspiring complementary actions from partners across the country, including great universities such as Texas A&M and great civic organizations such as the Chicago Council on Global Affairs. Now, much has already been done, but we want to double down our commitment to end hunger, increase healthy eating and physical activity, and reduce health disparities. There are 5 pillars that will help guide the efforts: improving food access and affordability, integrating nutrition and health, empowering all consumers to make and have access to healthy choices, supporting physical activity for all, and enhancing nutrition and food security research. I want to elaborate on some of the takeaways of that White House conference. And then I'll speak about how we at USDA are helping to implement the 5 pillars. So I moderated a panel at the conference on the importance of being inclusive in the data we use to inform our decisions and programs. A fundamental point is that people with lived experiences must be involved in developing the policies and programs that affect them. And we have to consider the cultural, medical, public health, economic, and social perspectives. For example, one of the panelists shared that a vegan doctor joined the health unit serving a tribal community and suggested that Native Americans consider adopting vegan diets, since there is a significant evidence that showing that a plant-based diet may help with chronic diet-related disease, including heart disease and cancer. However, One of the most sacred rituals of some Native American cultures is eating buffalo meat. It clearly is crucial to do the legwork first and speak to those in the community to test such ideas before raising them in a formal or public way. Another example shared by a panelist was a community college student. And there was, at her community college, that they conducted a food pilot to address hunger and food security among its students and their families. The researchers established a program to distribute food to the students. And at first, there were lots and lots of takers. But then the numbers of students started to dwindle over time. Our panelists shared that there were barriers for many of the student participants that limited the program's success. For example, some students were homeless and had nowhere to store the food that they received. Some students had no access to a kitchen to prepare the food. And some students had no consistent and suitable transportation to carry everything back to where they lived. The goal was admirable: feed hungry students and their families. But the same message as before applies: engage those with lived experiences first. A second takeaway from the conference is that as programs are developed, it's best practice to acknowledge the power and assets of those already serving the community. They already have relationships and trust. We need to partner with them and build on that. Next is the need to develop a diverse agriculture workforce and a diverse research workforce. Not only is this the right thing to do, but it will also have meaningful policy impact. For example, Native American physicians and PhDs that are knowledgeable about indigenous health can identify which programs or program components may work and which obstacles have to be overcome. The same holds true for other underrepresented groups. The last theme from the White House conference I've mentioned is the need to disaggregate the data to better understand individual communities. It's crucial that we remember that data aren't abstract phenomena. They are real people. That means we can't discount qualitative data. People are complex and unique examples abound. If we skip qualitative data, we miss the complete picture. In short, we have to use qualitative data to fill in the gaps and provide better context for quantitative data. As I said, underpinning the activities flowing from the White House conference is the need for rigorous, objective data. Clearly, food production, dietary selection, and health-related outcomes are complex issues that require scientific investigation across a variety of disciplines. And USDA is ideally suited to help address these needs because we have both scientific research, many of our scientific researchers are in the room today, and we have program delivery capabilities. So let me begin with program delivery. This includes the food and nutrition wing of USDA. We heard Catherine mention this branch of USDA earlier today. FNS operates more than 15 nutrition assistance programs which collectively serve 1 in 4 Americans over the course of a year. Together, these programs provide children and income-eligible people with access to healthy food, along with nutrition education and education resources to help promote healthy living. The figures are impressive. More than 41 million Americans are helped through SNAP yearly. More than 30 million children each day participate in our national school lunch and breakfast programs. Nearly half of all infants in the U.S. are served by WIC, Women, Infant, and Children programs. We have a unique capacity at USDA. We not only reach tens of millions of Americans through food programs such as these, we also carry out the science that informs these policies and programs. For example, we are conducting studies on food-based strategies for health promotion and disease prevention, including cancer and other chronic diseases. We and our partners are identifying the underlying causes of diet-related disease and cancers and developing culturally competent nutrition education for underserved communities. Now, while the NIH partners are partners, they work from the medical field and they do their critical work of detecting and treating cancer and other chronic diseases, which is critically important. Agriculture has a unique and important role in supporting this effort. That's because research has shown conclusively that food has the power to significantly reduce the risk of certain types of cancer. We're in the process of updating and fine-tuning our research and program delivery efforts. That's because to date, our nutrition guidance has been largely developed using that population approach that I mentioned earlier. But the latest research shows that people respond differently to food, depending on many factors, including age, sex, and ethnicity. Therefore, ensuring the best health-related outcomes will require precision nutrition approaches that focus more specifically on various subpopulations. Precision nutrition seeks to provide targeted, nutrition-based interventions to prevent and treat chronic diseases on a person's unique characteristics, such as personal health history, family health history, lifestyle, and cultural considerations. It assumes that each person may have a different response to food, so that the best diet for one may not be the best diet for another. In addition to helping individuals, precision nutrition can play a role in defining the nutritional needs for various subpopulations, including underserved groups. While precision nutrition promises to deliver more specialized dietary guidance for specific subpopulations, and remember, each one of us is a member of at least one subpopulation, achieving significant impact across the board will require broader consideration of the agriculture, economic, and social aspects of the value chain. As this conference has recognized, achieving these goals requires a systems-based approach connecting agriculture, food, the environment, economics, and human health. This is where groups such as IHA comes in. We're excited to see the development of IHA in partnership with the USDA Agricultural Research Service. Our collaboration emphasizes the role of precision nutrition in health promotion and chronic disease prevention, while also working to bridge the gap in health disparities and strengthening our food supply in general. Co-located within IHA, our Agricultural Research Service unit will partner with other ARS members and land-grant universities to bring big data, state-of-the-art sensors, and computational systems approaches to responsive agriculture and precision nutrition. We are also excited to see the interactions and engagement of IHA with the 6 ARS Human Nutrition Research Centers across the country, as these centers focus on developing food-based strategies for health promotion and disease prevention. And university extension will play a critical role in translating this knowledge to the public. I want to just take a moment here and deter from my remarks to just ask everyone who works with USDA, one of our Human Nutrition Research Centers, to please stand so that you can see who they are in the room. All of the USDA folks stand in the room. That's you too, Dr. Drum. Yeah, so here are our USDA folks in the room today. Thank you. Thank you. There's no doubt that the challenge before us is immense. While we can play a crucial role, the federal government cannot make transformative changes alone. It will require coordinated action by local, state, territory, and tribal governments, academia, civil society, philanthropy, the private sector, and other partners. And basically, it will apply to all of y'all. So everybody in this room has a role to play. So I'd like to challenge you to help us think big about the research and various strategies and partnerships needed to move us forward. This will no doubt take everyone, but I'm confident we have the will, the determination, and the brain power to do it. In fact, my worry is only that we will not be able to think big enough. Let me close by thanking all of you for your contributions to promoting agriculture and enhancing the availability of fresh, nutritious, affordable food for all Americans. I hope the rest of the day goes well as this morning. And again, I appreciate the opportunity to meet with you all today. Thank you.
Dr. Jacobs-Young, it's been an honor to hear from you and to be so inspired about hearing a little bit more about USDA's work and how you're leading those efforts there. So thank you so much for that. I just want to invite audience members, if you have any questions, we would like to take a couple of minutes to see if you have any questions. And if you do, feel free to go up to the microphone and ask your question. Don't be shy.
I was clear as mud. Well, I will be around during lunch and a little bit afterwards, so I would love to talk to you. And as well, we have identified the other USDA team members in the room. We are here. We are excited about this partnership. The partnership with Texas A&M is one that Dr. John Dyer has been brought in from Albany, California, to be able to lead with us and work with Pam Stark-Reed and the entire team, Dr. Stark-Reed and the entire team. And we're going to be announcing some new and exciting things in support of the Cancer Moonshot. And so I'm just happy to see this. I just want to quickly say, and this is a detour from my remarks, part of the graphics that Patrick showed this morning showed the impact on longevity. And many have heard me tell my story where many of my family members have died in their 50s. And we know that with diet and lifestyle changes, we could turn the tide on that. And so we can write a new chapter in the history of many of our communities of color. And so I'm very passionate about this topic. So if someone asked, do we have the political will? You absolutely have the political will from my position about what we can do and how we can be better about providing this type of guidance to many, many communities. So all people have access to healthy food and longevity. So thank you.
Well, I hope that you were inspired and energized by Dr. Jacobs-Young's remarks. For those of us joining via live stream, this concludes the open session portion of our conference. We'll take a break until about 1 o'clock, and Catherine Bertini will lead our afternoon discussion in closed session. So thank you for those of us who have been joining via live stream, and for those of you who are joining in person, we'll continue on in the afternoon after you've enjoyed your lunch and having conversations around the table. So thank you.